Some of the community work that I have done that has supported women includes working on the Maternal Child Health Task Force for Erie County. One of the first programs that we did with the Maternal Child Health Task Force was to do a symposium on postpartum depression. And this was done so that we could help people understand the problem of postpartum depression, but also to help them know what kind of resources were available for women and their family so that they would be able to seek appropriate help. Sometimes that help doesn't always come from a physician. So people were looking for resources. So that is something that we did to support women in the community. Another thing that I started in 2009 was our STIRK program. I got a grant from the March of Dimes for $48,000, and we created a program for one-to-one nurse-to-patient conversation to guide them through their pregnancies to have healthy outcomes. We felt it was important to give them evidence-based information so that they would know how to have a healthy pregnancy and thus a happy baby. I started the Cuddler program in the NICU long ago. There was a need for babies that needed to be held and loved and have human touch. Lots of times moms either live really far away or they aren't able to come all the time to the hospital. So we started the program in the NICU, again, a really long time ago, and it recently has started up again. It kind of fell away, and it has started up again. We have a lot of babies that are affected by drug withdrawal, and they need a lot of holding and loving. So we worked with the Hammett Aid at Hammett to bring them in, and they come in and they hold and they soothe our babies in the NICUs. It's a great service for our families. I think taking care of the families from a nursing standpoint, every moment's been joyful. Even when you have a baby pass away, the ability to work with a family and support them through that really hard time brings a lot of satisfaction to you because you're helping them work through one of the most difficult times in their life. I can remember with great detail many of my families and could tell you their stories today, even after 35 years of having been in the NICU. There's families just get into your heart and become part of who you are. We had one little baby who was born with a very bad infection, and we didn't expect him to survive. It was a long, hard battle for baby and for mom. On the day that he was discharged, I came in on my day off, and I discharged that baby and walked that baby down to the car, and the mom and I we just held on to each other. We were just so joyous to see that day come. So that was just one of my experiences that brought great joy to me. I always wanted to be a nurse. I don't remember wanting to do anything in my life except be a nurse. My mom told me she always wanted to be a nurse, and instead she became a mom and a stay-at-home mom. So I think she was my inspiration to be a nurse, and I always wanted to do maternal child health nursing. I was always fascinated taking care of women and taking care of children. So I was able to realize that out of 40 years of my nursing career, I've spent about 35 years of that in maternal child health nursing. It has always just been a part of who I am to help other people. I don't remember a time when I've not been involved in doing something like teaching Sunday school or doing Bible school, or I had 28 little brownies. It's just always been who I was, wanting to help other people. And a lot of nurses will tell you, that's just who they are. That's just what they've grown up to be. For other women to succeed, I would tell them to set their goals, map up what they want to do, and most importantly, surround themselves with people who supported them. To ask for help when you need it, and most importantly, always be ready to give back, because I don't think you can call yourself successful unless you're ready to give back to other people.